Thanks for tuning into the PeriHealth Pulse podcast. This is your host, Dane Steyer. I'm glad to have you with us for episode 3. Great episode with 2 nurses who are working on becoming SANE certified. So you'll learn what that is, learn what happens to sexual assault or domestic assault victims who come into an emergency room, what process did they actually go through, what happens after that. So we'll be speaking with them in just a minute. As a reminder, you can access all of the PeriHealth Pulse features by going to perimemorial.org/pulse. There's the email newsletter you can read and subscribe to that. You can listen to old podcast episodes or read blog entries. We had our emergency room director help us put together an investigation of what are all the things that go into the costs of an emergency room that makes it more expensive than other parts of healthcare. So you can check that out, again, perimemorial.org/pulse. And of course, if you've got topic suggestions or just want to give feedback, there's a form on that webpage that you can submit that, and we'll be able to read it, put that into play for future episodes. So thanks for listening. Enjoy this conversation with Kim and Erica. We're speaking with Kim Morse and Erica Dalrymple.
Hello.
We're going to be talking to them about being SANE certified, Sexual Assault Awareness Month, and some of the things that victims of sexual assault can go through if they're not dealt with people who are properly trained. So welcome, Kim and Erica.
Hello, thank you.
So you're both training to become SANE certified, so it's Sexual Assault Nurse Examiner, right? Mm-hmm. Now that sounds like something off of Law & Order SVU. Would there be somebody in that role on that show? I mean, that's what I'm picturing, a drama about this. And
so unfortunately, Mariska Hargitay does not play a SANE nurse, but she usually, when you see her coming to the hospital, that's who she's talking to, is someone who has done that exam or the kit or whatever. Yeah.
So part of our role as SANE is to work collaboratively with law enforcement, with the advocates, patient advocates from Freedom House, and also connect with the state's attorney's office. So the team, or the SART team, as there will be known as, is working together to make sure that steps aren't missed, that everything flows to make this the best possible scenario to help these people, these victims, become survivors.
We want to be sure that we help survivors get back control by supporting them, believing them, respecting them. And another aspect of our SANE nursing is the forensic exam that we provide. It requires a great deal of precision and detail as we collect the evidence, and it's really important that we collect it to the highest quality possible, because that really does help increase the prosecution rates.
If someone were to come into our ER and in very bad shape and claim that they have been sexually assaulted, what's the process right now?
So right now, this is one of the parts that Kim and I are working on with this whole program to get everything, in order. But right now, the ED nurses know that we are here and are to be called whenever there is an exam that needs to be done. So that patient would be taken to a private waiting room, and they also at the same time call immediately to Freedom House. They have a 24-hour advocate on call, and that person would come in as well, and then together the two of us would support that patient and offer them choices as to what they want with the exam. There's all different kinds of options. It can be given to the police or held, or however they want to do it.
Or we can simply just treat them for the injuries that are there. If they're not comfortable with following through with a kit, they don't have to do that. They have choices. But we want to make sure that we are helping these people as much as we can.
Mm-hmm. Sexual assault is always brought to the ER, just because that's where this kind of exam gets done. So that's why with us working with Freedom House, it's really important that if they get someone that calls in and says, I've been sexually assaulted, they're going to refer them here. to us. And that's part of our grant as well with Freedom House, is that we're creating this victim service center. So it doesn't necessarily feel like you're walking into the ER. You're coming into the victim service center, and we are able to do this exam for you.
And this victim service center will have a private waiting room separate from our standard hospital waiting room, private conference room, private exam rooms, all separate from the main hubbub of an ER department. So it's a very private area. These people will not be out and about with everyone else.
Lots of privacy.
Yes.
Very good. So I tend to imagine there's a lot of hesitation from some victims about whether or not to tell or who to tell. So if, whether it's telling law enforcement, family, friends, nurses at the hospital, what are some of the actions and statements that can happen that would traumatize them even more or make them even more hesitant to go forward?
I mean, law enforcement, hospital staff, anybody they meet along the way that, gives them a look, questions what they're wearing, well, you did wear a short skirt, or anything like that, maybe, well, you are married to him, so does it really count as sexual assault? Well, the answer is yes. If you said no and you didn't want it, it is your choice. And so what we're here for is to make sure that these victims understand that there's somebody there that believes in them, and is working very hard to make sure that we can keep them safe, that we get them the best help they need, and that, if they choose, that we are able to provide the best forensic evidence needed to hold this perpetrator accountable for what they did, so they don't hurt this person again or any other people.
So is adding that trauma by making them feel like they're not believed or not supported, does that affect the outcome?
I think definitely yes. I mean, even any little inclination that you may not be believed is going to deter people from coming in. But I think the fact that they came here in the first place is a huge step in the right direction. And then between Kim and I being able to, give them back control by giving them choices and, showing them that you don't have to report it to the police. We can collect a kit without ever reporting it to the police, and you can decide later that that's what you want to do. So it's just really about all of the choices that we have been taught in our training to be able to offer those. And like I said, it's all about giving them control back of the situation.
So that would make me think, for victims who don't necessarily want to pursue any legal action at the time, it's still very important for them to have that examination, collect the evidence, just in case.
Yes.
Because if they wait down the road, how much harder is it for it to go?
Exactly.
So, I mean, they have, like Erica said, there's options. So you can actually have all the forensic evidence gathered and have nothing done with the kit. Have it put into storage until you're ready to follow through with any sort of action, if ever. Or you can bypass the kit altogether. Of course, we would like to be able to help you in as many ways possible, but understanding that it's all your choice is really important. I mean, that's the biggest message I think I want people to hear. It's your choice.
Right now, what resources are available for sexual and domestic assault victims in the area?
Well, Freedom House is huge. I mean, they just do an amazing job. They cover, it's 5 counties that they cover. Yeah. And just a great network and support of people as far as, housing to counseling to education classes.
To child care for the people that are living with them during this time.
So Freedom House is definitely a huge, huge resource. And it's just so great that we live in Princeton, where we have Freedom House right here in town. And then, now with us being able to do this, and then we have the courthouse where our prosecutors are, it just really makes sense here in Princeton.
And law enforcement being specially trained to speak with sexual assault victims, and knowing to take them where they need to take them,
Yep.
and how to get them the help they need. So, this whole, like I said, the government, the federal government, the state government, really understanding the importance of needing these services and getting all of these different agencies together, training and working together is really awesome. Mm-hmm. And I think now more than ever, there's this understanding of the need for it.
Yeah.
Well, this is fantastic program that you're working on, training that you're going through. Appreciate you being on here to discuss it, Kim and Erica. Thank you so much.
Yeah, thank you for having us.
So that wraps up episode 3. Hopefully you found that interesting. If you have more questions, Kim and Erica are definitely people you can reach out to, have further conversations about this, find out more. I'm going to put their contact information on the page for this podcast. So if you go to paramemorial.org/pulse and go to the podcast, the page for this episode will have contact information and other resources so that you can have even more benefit than just listening to this. Coming up, this is still the month of April, which means it's Occupational Therapy Month. And we want to do a little bit more with that. We had a conversation with Doreen Mercer already about Tai Chi. That was episode 2 of the podcast. We do want to showcase a little bit more than that. So next week, the last week of April, there's going to be a blog entry about, from an occupational therapist point of view, what's the worst bone to break in the whole body. We have our opinions, but they've got kind of a unusual thought on that, and hope that you'll find that as an interesting read. Keep an eye out for that next week. Take a read, give us some feedback. Thanks for tuning in to The Pulse.